Hi, friends. This is the Thriving Aligned Healing Podcast, and this is episode 202, and we are continuing our discussion in our series on neurotransmitters. And today we're going to highlight serotonin. Um, Serotonin, a lot more folks I think are familiar with serotonin than they are some of our other neurotransmitters. And I think a big part of that is because of our pharmaceuticals, right? And when we think of serotonin, when we think of depression or depressive thoughts, oftentimes the go-to neurotransmitter to understand is serotonin. And so I want to give us a better understanding and a little bit better framework around what is serotonin, what does it mean, or what does it do, and what kind of symptoms to look for if we think there's an imbalance in serotonin. Okay, so serotonin has been coined the confidence molecule because we find that when our serotonin is low, there is a lack of rejection sensitivity, right? So what that means is that when it's hard to hear no, right? Or sometimes the idea of rejection can be larger than the actual rejection itself. So we don't even try new things, or we don't do new things, or we don't go to situations or have conversations with people because we think that it will be met with a negative response, right? And what we find is that the more serotonin that we have in our body, the more resilient we are to this idea of rejection or of a negative response, right? We're more willing to take risks. We're more willing to try new things that we haven't tried before. And so sometimes that can be a pretty good indicator, right? Like when we talked about all the rest of the neurotransmitters, it's always a spectrum. And so, we don't have to be depressed or like have major depressive disorder to experience this rejection sensitivity. It can be within that spectrum, right? Um, so oftentimes when we address serotonin, right, we're looking at things like self-esteem, right? Things of like feelings of worthiness, this sense of belonging. This is often associated with our serotonin neurotransmitter. Now, serotonin is one of a chain of neurotransmitters, and not only is it part of this confidence molecule, but it's also a significant player systemically in our circadian rhythm. When we talk about circadian rhythm, most folks think about our sleep patterns, right? We may have heard of circadian rhythms around our sleep patterns, which is right, like how well we sleep, do we get deep sleep, how long does it take us to fall asleep, are we waking up, in the morning, are we a night owl, right? Like, are we kind of slow going in the morning? This is the idea of our circadian rhythm and kind of balancing out our sleep patterns. But our circadian rhythm is also associated with more systemic things besides just sleep, like our gut health has a significant influence from our serotonin. Whether we're digesting our food well, whatever our transit time is, which is how long it takes us to digest food and eliminate it, if we're having regular bowel movements, those are the types of things that are also associated with a balanced circadian rhythm, right? Our For women, our hormone cycles, technically for men, their hormone cycles as well, is also associated with this idea of the circadian rhythm, whether it's in balance or not. And so when we look at serotonin, it's not just our mood that's associated with this neurotransmitter, but right, it's also right our sleep, it's also our digestion, and it also affects our cognition or how well we think. And we saw this a little bit with dopamine as well, right? As far as our memory, learning, things like that. Is definitely associated with all of our neurotransmitters. But when we look at serotonin and we look at whether, we have symptoms of low serotonin or symptoms of elevated serotonin. This one is one that I like to talk about because it's kind of different in a sense, because we often think of our serotonin when it's low, right? That we can have depression, we can have anxiety, panic attacks. But what's a little bit unique is there's this kind of sweet spot for serotonin, because when it's elevated, we can also see increased anxiety and panic attacks, right? We see a little bit more like agitation, and maybe like IBS type situations when our serotonin is elevated. Right. And this is something that a lot of times we don't talk about, in the conventional world, or especially if we're looking at like pharmaceuticals, things like SSRIs or SNRIs. So those SSRIs are things like the serotonin specific reuptake inhibitors, like the Prozac, Celexa, Lexapro, Zoloft, things like that. And now we're using those medications for not just depression, but like eating disorders, right? Post-traumatic stress disorders, even for pain. Now we're using those medications because they're influencing, right, the amount of serotonin that's in our body. And it's usually under the presumption that we are too low in serotonin. And so that's why, part of the reason we don't talk about an excess amount of serotonin. Now, serotonin is not just associated with those behaviors or like the feelings of anxiety and panic attacks, but sometimes our obsessive thoughts or obsessive behaviors, whether it's like OCD or a syndrome of obsessive compulsion, can be a sign that sometimes our serotonin is a little bit out of balance, right? We can see our PMS, our PMDD symptoms can also be associated with our serotonin, because there's a really interesting relationship between our serotonin and our estrogen and progesterone, which we will dive into that in another podcast. But since serotonin, right, is associated with that circadian rhythm, why we can see like digestion issues being associated with serotonin. We see this a lot with, well, okay, I see this a lot with kids who have a little bit more like anxiousness, and they're, having stomach aches. And so they're either going home or they're not going to school because of stomach aches, because they're anxious about something. Or maybe they've had digestion issues since a baby, and then it's kind of turned into this emotional piece as well as triggering these digestive issues. We can see this in adults as well. Sometimes folks who have IBS, or whether they recognize whether it's related to emotion or not, but people who've had like loose stools and diarrhea for 20 years or 30 years, or as long as they remember. When we look at the whole person, it is a healing the gut, but it's also looking at, well, again, what's that root cause, right? Are there also neurotransmitters that are playing a role in that, in their gut health? Now, serotonin, in the pathway to make serotonin, it starts with the neurotransmitter tryptophan, and we may be familiar with tryptophan, especially around Thanksgiving. A lot of times folks have heard about tryptophan because of turkey. So we're thinking like after that turkey meal, right, we get a little bit more tryptophan and then everybody gets sleepy. Well, tryptophan is an amino acid, and it's found in other proteins as well. You find it in chicken, in turkey. There is some tryptophan in even our red meats, and our body uses that tryptophan as the building block to make serotonin, and then from serotonin it metabolizes into melatonin, and so melatonin, right, is our hormone to help us get sleepy. And so melatonin is definitely one that's readily available over the counter. And a lot of folks will say, well, melatonin doesn't work for me. Well, it usually works for the folks that are deficient in melatonin or deficient in serotonin. So that can be an indicator of whether it's going to be beneficial for you. And sometimes we do that on a trial basis, but since not everybody's deficient in melatonin, it's not going to benefit everybody's sleep patterns. But so we can also see on that spectrum of symptoms that are associated with serotonin, a disturbed sleep or decrease in like regular sleep patterns or that circadian rhythm, that disturbed sleep or insomnia. We can see, yeah, symptoms like that as well. Now, um, yeah, hopefully that makes sense in that connection with melatonin. Um, Another thing that we can see with serotonin changes is this idea of this rumination, right? Sometimes we call that rumination like a monkey mind, or we have a tendency to have a little bit of like obsessive thoughts, or sometimes it's just like replaying things over and over in our mind. Sometimes it's usually from a negative aspect, the self-criticism, that negative reel can also be a symptom of changes in our serotonin. And so when we're looking again, like the whole picture, sometimes when we go through and we kind of describe some of these symptoms, people are like, "Oh, that sounds like me." All of those symptoms are similar, right? This idea of like a little bit of anxious thoughts, right? Like overthinking things or excessive self-criticism, sometimes with a negativity, low self-esteem. Maybe there is a little bit of PMS or PMDD, digestion issues, right? We can also see things of like perfectionism and trying like to be controlling, and that also kind of plays into this idea of OCD or obsessive thoughts or behavior, is that oftentimes we want to control things when we feel like things are out of control. And so that need to control things can be a gauge of kind of where our serotonin is. Yeah. Now, I talk to folks a lot about cravings around digestion because cravings can also be associated with our microbiome and our gut health. Um, but we can also see cravings associated with serotonin. So oftentimes when we have cravings for carbohydrates, not always sugar. So it's a little bit different, right? A lot of people will say, "Oh yeah, I have that sweet tooth. I have a craving for sugar." And sometimes that can indicate other imbalances in the gut. But it's kind of this idea of craving for carbs. So this craving for like breads and pastas. It's not necessarily cookies and candy and sweet things. It's those carbohydrates that can indicate, right, that there's a little bit of a change in our serotonin balance. And so we can also see, yeah, cravings for alcohol and drugs as well. Um, Serotonin is also associated with our pain receptors. And they're doing a little bit more research right now on the relationship in women on estrogen and progesterone, the influence of estrogen and progesterone on our serotonin and our pain receptors to kind of help to uh, bridge that gap or that triangle to help us understand, right, how to kind of manage pain, especially in women. And so we can see things like fibromyalgia, TMJ, chronic fatigue syndrome, um, and like tendinopathies or uh, tendinitises in women, or yes, in women. And in men, but because of the relationship of serotonin and estrogens. And so we're seeing relationships with uh, the more serotonin receptors that are in any given cell or given area can increase the susceptibility to pain because those because they can trigger pain, or serotonin can trigger pain receptors. And so we're seeing this relationship again because they're starting to use SSRIs for pain. So not just for depression and anxiety, but also for like neuropathy pain, for like chronic pain or complex regional pain syndromes. They're looking at using SSRIs or other pharmaceuticals that manipulate our serotonin to reduce the pain perception, right? Because of the how that serotonin acts on our pain receptors. So I think that's yeah, helpful to understand because sometimes people are coming in and they're like, oh, well, there was a I think there's a little bit less of a stigma now on SSRIs and pharmaceuticals for serotonin and for depression. But sometimes it can be a little bit of a misunderstanding or a little bit confusing when you go in for pain. That's like legitimate pain and they're sending you home with like Zoloft or Lexapro or something like that, right? And then if they don't have, if the practitioner doesn't have this conversation with you, then it feels like, oh, well, they just think it's in my head, right? And then people don't take that medication, but they're still in pain. They're not addressing the root cause. Um, but that's how they're seeing some of that relationship of supporting our serotonin levels to help to reduce pain. Now, I'm going to take a minute here to explain how SSRIs work because I don't think I've explained that. So when we talk about that pathway of how our body makes serotonin, right? It starts at tryptophan, it goes to a precursor, 5-HTP, then it goes to serotonin, then a metabolite, and then melatonin. And what happens is that, so that's how the way our body naturally makes serotonin, okay? So what's supposed to happen is that when we make that serotonin, our body puts it in these vacuoles and then it releases it into um, this space, which then it travels down the neurons and then like kind of triggers a whole biochemical cocktail, if you will, of other hormones and signals. And um, when you use an SSRI or SNRI, what's happening is that your body's producing the same amount of serotonin and it gets uh, deposited or into that cleft and starts to go down into the neuron. Well, what's supposed to happen is that our body uses that and then our body recycles it, right? It's takes a lot less energy for our body to recycle those neurotransmitters and hormones, and then it only has to make part of the pieces instead of making it from scratch every time. And so we have specific enzymes that go through, and once that neurotransmitter is does its job and is used, then right, it goes through and it recycles the pieces. Well, the SSRIs, what they do is they keep that serotonin around longer. So they kind of block, right, those enzymes from going in and recycling that serotonin. So the idea is they're increasing the concentration of the serotonin in that area for longer, right? And the idea is that the more that they do that, it tells the body that we're in this feast mode of serotonin and our body is efficient and says, oh, look at all this excess. We want to use it and make the most of it. So then it will increase receptors, right, in the brain for that serotonin to bind to. So then your body can use it a little bit more efficiently. And so that's the goal with a lot of those SSRIs is that when you are producing that serotonin, that now there's more receptors available to bind to that serotonin. So then, right, you can stimulate those biochemical pathways in those cocktails to send out the signals that it needs to balance our mood, to help to support our circadian rhythm, right, to reduce pain, all of those things. And so so that's the goal behind, right, those pharmaceuticals and how to support our serotonin levels. Now, when we're looking at a root cause perspective, we're trying to figure out why is our serotonin out of balance in the first place, right? And what's contributing to that? And where can we support it? Where can we support that natural pathway to produce appropriate amounts of serotonin that our body needs at any given time? So addressing the pathway of how our body makes our serotonin, I think is very important. And so I mentioned that tryptophan, right? When we increase the amino acids or the building blocks for those neurotransmitters, oftentimes, right, it makes it easier for our body to make right that those things available. So I like to encourage people to explore foods that are rich in tryptophan. And this doesn't just include chicken and turkey. This can also include things like pumpkin seeds, walnuts, right? Things like legumes or beans, right? Any type of beans, quinoa, mushrooms, spinach, even. Um, those foods are known to have significant levels of tryptophan in it. Now, those aren't the only foods that have tryptophan, but if we're trying to increase the availability of that amino acid in order to promote our body to make its own serotonin in appropriate amounts, making those building blocks more available is a great way to start and kind of push that needle forward in increasing our serotonin levels.
Can you talk about why our serotonin levels would be off? Like, if you're talking about root cause, like, okay, why is our serotonin off? Like, what are some potential reasons that people could have them off? Because I feel like maybe like mine have been off since I was a child. So, like, is there genetic reasons? I know there's genetic, there's environmental, there's probably emotional. Can you kind of talk about that?
Sure, yeah. So there's a lot of potential root causes, but some of the biggest ones, and the ones we start with when we're talking about nutrition is, do we have deficiencies, right? So, that's a perfect segue. If we don't have enough tryptophan in our diet or in our body, to make serotonin, then that can be another reason why we have a little bit less. Now, tryptophan isn't the no. Serotonin isn't the only molecule that uses tryptophan, right? Or when we talk about amino acids, it's not just one molecule that does that. It's the entire body and all of our cells. So we also need cofactors in order to move those molecules down the pathway to actually ultimately make serotonin. And some of those cofactors are things like B vitamins, right? So like our B6, our B12, and so some of those we can naturally be a little bit lower in B vitamins. Definitely our diet, if we're not eating leafy greens, are associated with our B vitamins, right? Our leafy greens probably have the highest concentration of B vitamins in them. There are medications that deplete our B vitamins. So for women, birth control, we know depletes our B vitamins, and they don't tell us that. There aren't very many practitioners that I know of that when they start a woman on a birth control, whether it's an oral contraceptive, whether it is an implant or like a ring, they need to be taking B vitamins because it depletes your body of B vitamins. There are also other medications like blood pressure medicines, anti-diabetic medications that will deplete your body of B vitamins. So that could also be part of the reason of a root cause is that we're low in our B vitamins. Our iron levels are pretty significant. So if we've ever been told that we have anemia or suspect that we have anemia, or if you've ever been, right, like turned away from giving blood because your hemoglobin was too low, there's a potential that that can contribute, how well our body can make serotonin, and our vitamin D levels, right? This is why I encourage people to get your vitamin D levels tested. Because if we don't have enough vitamin D, right, and these are cofactors that all of our cells use, not just our body in making serotonin. So if there's not enough of our B vitamins, or not enough iron, there's not enough vitamin D, as in dog, D3, then, we're still making those things. It's just at a lesser amount. Your body has to allocate that energy and like those resources appropriately. Um, so our vitamin D is essential. So there's also, right, theories of why we can experience seasonal affective disorder, or we see changes in our mood when it's in the wintertime, or when we move to an area that has a little bit less sunshine, is because our body's not getting those cues. It's not getting the ability to make our vitamin D. Um, and then when we talk about that, there are also some genetic SNPs where we don't make enough vitamin, or we don't make okay. Our ability to make vitamin D may not be 100%. And so we also have situations where sometimes people will supplement vitamin D and they can't create the active form of vitamin D from that supplementation. And then you're right, there can be a genetic component where sometimes our genes don't make the right amount of enzymes in order to, again, move that pathway forward. And so this is where a lot of people will say, well, it runs in my family. Like, because we ask, right? Does like depression, does mental illness run in the family? Does anxiety run in the family? And some people will say yes, even though it was never diagnosed. That can still tell us, right, that there may be a genetic component of whether our body is able to move like that tryptophan to use that to make enough of that enzyme to go to like 5-HTP and serotonin. Now, the trick with that is that we may have a little bit of a genetic component, and our body makes proteins and makes enzymes, right? Like, or makes proteins. That's what our body does. All our cells are designed to do. Well, we get to control that switch on whether that our body, those cells are making the right proteins, or whether they're turning off their protein or their ability to make those proteins or protein production. And so this is where we talk about epigenetics, right? Because even though there can be a genetic component, we control the ultimate instructions on whether our body makes those genes or not in order to, right, make our serotonin. Now, there's also a root cause of environmental toxicities, right? So there are some heavy metals, mercury and lead, that we know that can stop the production of these enzymes so that we can't move forward and make our appropriate neurotransmitters. So we can see that relationship of those heavy metals blocking those enzymes. So that can also be a component of a root cause. Yeah. This is where looking at individual situations, I think, is so important, and not just trying to identify, right, like, hey, I think my serotonin might be out of balance because of these reasons or these symptoms, right, or the testing that we have. But let's dig deeper, right, to trying to figure out your root cause. Now, definitely our mindset plays a big role, right? Because we create these pathways and these loops in our mind. Of whether the demand for our neurotransmitters change or not, right? So we definitely have a direct impact that in that manner as well. Yeah, but sometimes I think just understanding the framework of where serotonin comes from, how our body uses it, how we can influence its production or its storage or its use, I think kind of all goes hand in hand. All right. Um,
So what would be your advice then? Like, what does the path look like for someone to kind of discern, like, okay, is this genetic for me? Is this my diet? Is this mindset? Like, it would feel pretty overwhelming. Like, where do I even begin? Like, I obviously have some of these symptoms. What's my steps?
sure. So, um, we start with the basics, right? Because sometimes our body just needs a little bit of support. I mean, our body innately knows what to do, right? All of those instructions are already in our cells and already in our DNA. Sometimes it just takes a little bit of support. So it becomes a little bit of a layering situation. We start with addressing any potential deficiencies, right? So if we suspect B vitamin deficiency, if we get our vitamin D3 tested and it's not within optimal range, it's less than that 60 to 80, we start supplementing, right, appropriate amounts of vitamin D3. If we have a suspicion or a history of iron deficiency anemia, Well, we have to go down that rabbit hole and fix that, address the iron deficiency, address the anemia to influence our serotonin. Now, we can also increase foods that naturally have serotonin in them. So I do prefer testing because I like to see the data, right? And it gives us a baseline of where we're at because those symptoms can be very similar in a low situation and in an excess situation. Sometimes actually seeing the testing can be really helpful, and it lets us take the time to create an individualized plan for folks so that it's not overwhelming, right? And we can do it kind of a step by step because then we can address some deficiencies. If it does look like it's a genetic component, right? We can be specific with the precursors of serotonin. And so we're taking some of the work away for your body to make that serotonin so we can kind of feel better faster while we're working on our mindset, while we're working on, right, like that epigenetics piece so that you can train those cells to continue to produce those proteins and enzymes to make the neurotransmitters. Um, there are some foods that naturally have serotonin in them. And so, like, I like to encourage people to increase these foods, whether they suspect there's like a serotonin imbalance, or even if they're on like an SSRI or an SNRI. So they're already on a medication, and we have to kind of maneuver around that with supplements. We can always do it with food. Right. So we can always just start there. So again, increasing our foods that are high in tryptophan, but the foods that we know that are higher in serotonin are things like bananas, pineapple and pineapple juice, tomatoes, and all of the products with tomatoes, like pasta sauce, ketchup, things like that. Eggplant and avocados. And usually fruit, kiwi, like fruit in general, is usually higher in natural serotonin. So sometimes this is a good thing like to get started with. So sometimes I have folks who suspect a serotonin imbalance, but they don't want to go on a medication or, for they don't want to go on a medication. And so we look at increasing these foods on a daily basis and see if they notice changes in their mood, changes in their behavior, changes in their sleep, changes in their digestion, right? That can be associated with serotonin. And then we kind of do it on a little bit of a trial basis. But when we get the labs to see where we're at, it's much easier to do an individualized program for folks so that it's not overwhelming. Yeah. Um,
Yeah, that makes sense. Thank you.
sure. Yeah. Um, okay. So what I wanted to wrap up with is to kind of get an understanding is that we've introduced, right, dopamine, we've introduced norepinephrine, epinephrine, or noradrenaline and adrenaline. We've introduced serotonin. I do have a couple more neurotransmitters that I want to talk about in the next couple of episodes, but I also want us to understand that it is the relationship between all of those as well, right? It's when our neurotransmitters are off, it's usually rare that it's just one, right? Because they're so interconnected, it's the balance between, or the relationship between our dopamine and our dopamine and our norepinephrine and our serotonin, right? And so if we were to draw these in circles, all three of those would overlap and they would have balances and imbalances in each overlap. Because our brain is complex, right? But we also have that influence to balance all of those circles and all of those overlapping pieces. And I think this is where it's a little bit different, is because when we look at the whole person and the whole brain, the whole body, right, and the whole mind, is that it's not just picking out pieces of like, oh, this is a serotonin problem. Oh, this is a dopamine problem. Oh, this is a norepinephrine problem. It's like, oh, okay, well, let's see where those problems overlap. That's what we want to address, right? But I think it's helpful to get an understanding of how each player shows up in our daily life, in our right mood, in our thought process, in our level of cognition, to help to understand how those pieces fit together. Yeah, perfect. All right. I think that's all I wanted to share today about serotonin. Any questions?
No, thanks, Carmen. That was really good.
Excellent. Thank you.